Foot and ankle pain. Beyond obvious injury, there are several common causes of foot pain. Many of these problems can be diagnosed by the specific areas in the foot or ankle they affect. Below shows the main structures affected by foot pain. Achilles tendinopathy. Achilles tendinopathy is caused by damage or inflammation in the tendon that runs from the calf to the heel bone. Tendons are strong cords that connect muscles to bones, and support the structure and movement of your feet and ankles. The main symptoms are pain in the Achilles tendon which worsens after activity, difficulty moving the foot up and down, a grating sensation, swelling, redness or heat around the tendon, a lump on the tendon. It commonly affects people who do sports involving a lot of running or jumping, have some types of inflammatory arthritis, have high or low arches. Achilles tendinopathy can take anywhere from a few weeks to several months to fully recover. However, the self-care tips outlined above should help relieve your symptoms. Tibialis posterior dysfunction. Tibialis posterior dysfunction causes pain, redness, warmth and swelling in the tendon that connects the inside of the calf to the arch of the foot. Your ankle or heel may feel weak and it can cause the arch of your foot to drop. It can make walking, standing for long periods of time, or rising to your tiptoes difficult. It can feel worse when you are active, particularly if you are running or jumping. It is caused by inflammation, damage or a weakness which overstretches the tendon. If left untreated, it can eventually make the arch of the foot collapse. The self-care tips listed above should help with your recovery. However, if the pain is severe or has not improved after 2 weeks, speak to a healthcare professional. Plantar fasciitis. Plantar fasciitis commonly causes pain in the center and inner side of the heel. It's caused by damage to the strong band of tissue, called the plantar fascia, which runs from the heel to the base of the toes. The plantar fascia should support the arch and help to spread your weight evenly through your foot, so you can walk, run, or stand without difficulty. However, plantar fasciitis can make it difficult and painful to use your foot properly, particularly just after rest or following activity. It can increase the risk of lumps of calcium growing on the heel bone, called bone spurs, which could cause more pain when you move the joint. The self-care tips should help your plantar fascia heal, though it could take up to 18 months to fully recover. Speak to a healthcare professional if you feel no improvement after 2 weeks. Bursitis in the foot or ankle. Bursitis causes pain and inflammation, commonly around hard-working joints such as in the big toe, ball of the foot, heel, or ankle. It can also affect any part of the body. It is caused by swelling in a small pocket of fluid, known as a bursa, or bursa if more than one is affected. Normally these small pouches cushion and protect your bones, joints, and tendons from impact, rubbing or pressure. However, repeated rubbing, friction, excessive pressure, or injury can cause the fluid inside to increase, making the affected bursa inflamed and tender. For example, you can get bursitis between your ankle and heel if you keep wearing shoes that rub, pinch, or press down on the area. Shoes that are too tight and high heels regularly cause bursitis. It often appears as a red, painful, swollen lump. However, it can also cause general swelling that you only notice because of the pain, for instance on the bottom of your heel. People with bunions or irritated joints can be prone to bursitis. Rheumatoid arthritis can also cause bursitis, particularly in the ball of the foot. The self-care tips recommended earlier should help relieve your pain and inflammation. However, instead of bandaging the area, try using adhesive padding on the swelling to protect it from further friction and pressure. Resting it on a cushion can also help. If you find self-care treatments are not helping, speak to a healthcare professional. Changes in the shape of your arch. The arch is the inside midsection of your foot. It determines how your body weight is spread and carried by the bones and joints of your feet. For your foot to function at its best, the arch should form a smooth arc from the ball of the foot to the heel. The height of your arch may never cause you any kind of problems. Some people are born with arches that are higher or lower than average and their bodies adapt to them. Other people may find their arch shape alters because of complications such as arthritis, weight, pregnancy, or injury. These changes can make you more likely to develop further problems in other parts of your foot, ankle, knee, hip and back. If you are in pain and think your arch shape has changed, speak to a healthcare professional about treatments. Insoles or supports made specially for your foot shape by an orthotist could improve pain caused by high or low arches. Low arches. A low arch can affect how your foot and ankle works and bears weight. For example, it can make you lean in on your ankle and force your heel to spread outwards. It can put more strain on your feet, ankles, knees, hips and back. People who naturally have flat feet are less likely to experience problems in these areas because their bodies adapt to their natural arch shape. However, arches that fall or drop from their normal shape can make you more likely to get overuse injuries. Your body posture or balance may also change, which can increase the strain on your legs, knees, hips and back. High arches. People with high arches are more likely to walk on the outer edge of their feet because their arches push their feet and ankles outwards. It can put excessive strain on the ankle, heel, and ball of the foot, increasing the risk of problems such as plantar fasciitis. Problems linked to low and high arches. Arches that are higher or lower than average can increase your risk of developing other problems, such as valgus heel, hammer toes, retracted toes, clawed toes, mallet toes, bunions, corns and calluses. The self-care tips can help ease pain in your arches. Changing your footwear to a well-made running trainer that you feel supports the shape of your arch may prevent further painful changes to the structure of your arches. Insoles and arch supports can help, but it's best to visit a foot specialist, such as a podiatrist, to get ones designed specifically for your foot shape. If you're buying new footwear, it's best to take any adaptations, such as insoles, padding, or arch supports with you, as you may need a larger shoe size to fit them in comfortably. Losing weight, if you need to, can reduce the strain on your arches and may prevent further long-term changes. You may find it difficult to do exercises that put a lot of pressure through your feet. Swimming is a good way to improve and maintain your fitness because the water supports your body weight. Other causes of foot pain. Pain in the foot can be a consequence of damage, pressure or rubbing over a long period of time. Wearing badly fitting shoes, pregnancy, injury, or putting too much strain through specific parts of your foot can all cause changes in the shape of your feet. Often, these changes are painful and can affect your ability to do things. Sometimes, it's our choice of shoes that has the biggest impact on the structure of our feet and the problems we develop, such as calluses. Calluses are patches of rough, hard, slightly raised skin that build up on your feet, particularly on points that take the most pressure or rubbing. These patches can be more sensitive and ache more than other parts of your foot. They can be controlled by gently filing the area each week with a pumice or special foot file. If they are left, they can turn into corns. Corns. Corns are raised areas of hard, knobbly skin which develop where calluses have been left untreated. They often cause a burning sensation. A corn is a permanent change to your foot which will need care and management to stop it becoming too painful. You can manage corns by gently filing or pumicing them each week. You should never cut the skin with a blade. Corns and calluses will usually grow back within 4 to 6 weeks unless you reduce the pressure on the area. Wearing softer, roomier footwear and placing a cushioned pad over the corn or callus can help. Neuroma. A neuroma causes sudden shooting, stabbing, or burning pain. Most commonly it affects the third and fourth toes and the ball of your foot. Athletes and people with low or high arches, bunions or hammer toes commonly get neuromas. Bunions. A bunion is a bony lump that develops on the side of the joint at the bottom of the big toe. It can change the shape of the joint, making it bigger, so it sticks out more. This is called hallux valgus. In extremes, it can alter the angle of your big toe, making it bend towards your other toes. Clawed, mallet, retracted and hammer toes. Clawed, mallet, retracted or hammer toes are conditions that cause the toes to curl or lift out of line. The main difference between each condition is the joints that are affected in the toe. However, they tend to be treated the same way. These conditions are linked to several other foot problems, including bunions, flat feet, high arches, tendon problems, and badly fitting shoes that squash your feet. Arthritis and problems with the nerves in the foot can also cause them. Hard skin can build up over the raised toe joints, making them uncomfortable and more prone to sores, calluses, and corns. You can manage these problems by wearing soft, cushioned, wide-fitting shoes, using insoles and applying padding to the painful area. Paracetamol, ibuprofen, and pain relief gels or creams can also help. Your doctor or a podiatrist may recommend using rubber, leather or silicone splints to relieve your discomfort. However, these changes in the toes can only be permanently corrected with surgery. Sores. Changes in the structure of the foot can make you more likely to get blisters or open sores. It is important to keep wounds clean and protected with a clean dressing or padding, to stop them getting infected and help them heal. Also known as ulcers, these wounds can be particularly problematic for people with conditions such as rheumatoid arthritis, Raynaud's phenomenon, lupus, scleroderma, diabetes. Some sores may not heal without specialist treatment, and in extreme cases they could cause an infection in the bone, called osteomyelitis. It's important to tell your rheumatology team about any wounds.